I'm Lisa Richardson. I'm the Division Director of Cancer Prevention and Control at CDC. Well, currently the number of cases per year diagnosed, or about number of women, diagnosed each year is around 220,000. Still about 40,000 women are dying every year of breast cancer. Breast cancer trends have been improving with decreasing incidence rates as well as mortality rates. But given the aging of the population, the number of cases of breast cancer have increased recently. The racial and ethnic differences in incidence, for instance, Black women having a lower incidence of breast cancer is actually converging more to the overall rate of breast cancer. So that's also a puzzle as well. Lots of places for people to get in and look at these changes that are coming. Well, the one risk factor that women don't fully understand, or maybe the public in general, is that aging is the number one risk factor for breast cancer. So as you get older, your risk of cancer increases regardless of your family history, which is why we recommend mammography over a certain age, usually starting at 50. Well, some of the things that women can, behavioral factors that women can modify to lower their risk are to drink less alcohol, participate in physical activity, and maintain a normal weight. I believe breast cancer risk is increased by alcohol by about 1.2 odds ratio or so. And it's felt that it increases the amount of estrogen that circulates in the body. Genetic risk factors, we think, accounts for about 5%, a little bit more of breast cancer in the community. The number one breast cancer genes that we know about are BRCA1 and 2. These are the high-risk genes that we look for most commonly among women with a strong family history of breast cancer. There are several things that women can do to lower the risk of breast cancer, especially if they're at high risk. These include medications such as tamoxifen, which is a breast cancer therapy that is now being used for prevention. And some of the other medications like serotonin. Another maneuver that women can do, or procedure they can do, is to have a mastectomy, which lowers their risk at about 70 to 90%. A third of the risk can be lowered by using tamoxifen. Our challenge has been getting women to use the medication because it has a number of side effects, including stroke, high blood pressure, and blood clots. And not to mention uterine cancer, which is another type of cancer caused by the medicine. So it's a hard sell to women to do that.